Are asymptomatic pituitary microadenomas dangerous? Imagine finding a tiny bump in your brain during an MRI scan for something else. That bump could be a pituitary microadenoma, a small tumor less than 10 millimeters in size. These are often found incidentally, meaning you might not even know you have them. The good news is that most of these microadenomas are not considered dangerous in terms of immediate health risks. They are benign, which means they do not spread or turn into cancer, and many do not cause any symptoms at all. Most microadenomas do not produce excess hormones, so they are called non-functioning tumors. Because they don't secrete hormones, they usually don't cause symptoms like hormonal imbalances or physical changes. Often, they are discovered during scans for unrelated issues, and if they are small and not causing problems, doctors typically recommend just monitoring them rather than immediate treatment. However, some microadenomas can be hormonally active. If they secrete hormones like prolactin, they can lead to conditions such as high prolactin levels, which might cause menstrual irregularities or infertility. If they produce too much cortisol, it could lead to Cushing's disease, or if they produce excess growth hormone, it might cause acromegaly. When these hormones are involved, symptoms like headaches, vision changes, or unusual hair growth can occur, and treatment becomes necessary. In terms of growth and pressure effects, microadenomas are usually too small to cause issues like pressure on the optic nerves or surrounding brain tissue. Larger tumors, called macroadenomas, are more likely to cause such effects. The chance of a microadenoma growing significantly or causing a sudden bleed, known as pituitary apoplexy, is very low but not impossible. It's also important to understand that pituitary adenomas, including microadenomas, are benign tumors. There is no evidence linking them to an increased risk of brain cancer or other malignant brain tumors. Research has not shown that having a microadenoma raises your risk of developing brain cancer. Because these tumors are quite common, found in about 10% of the population, routine extensive testing isn't usually necessary unless symptoms develop. A simple blood test to check hormone levels can be a good starting point. If hormone levels are normal and there are no symptoms, doctors often recommend just periodic monitoring with follow-up imaging if needed. In summary, asymptomatic pituitary microadenomas are generally harmless and do not pose a significant health threat. They rarely cause symptoms or grow large enough to impact surrounding structures. Regular checkups and personalized medical advice are key to ensuring they remain benign. If you or your doctor notice any changes or symptoms, further evaluation can help determine if treatment is needed. Always consult healthcare professionals for tailored guidance based on your specific health situation.